talking about part 3 of the Safe Infant Sleep series. And today we're going to be talking about different sleep locations. And I think this is a very important topic because just like I mentioned that SIDS is sort of something that we fearmonger, or our society fearmongers parents into thinking they are going to cause for their baby. Society also fearmongers parents into thinking that bed sharing is not safe, and that if they ever do sleep in the same bed as their baby, they're going to somehow kill their baby. I know that sounds dramatic, but it's true. This is what our society is doing to new parents right now. And the thing is that bed sharing, not only can it be done safely, but it is a practice that is used wildly all over the world in various different cultures. And it is used safely. And they, in different cultures, don't actually even have sleep problems like we do here in our Western sort of culture. And so it's something that needs to be talked about, because the thing is that bed sharing is very natural and very normal. And it's kind of a biological necessity for your babies and young children, especially at the beginning. And the thing is that, of course, we want to take into consideration risk factors. And we talked about some of those risk factors in part 2. So if you haven't watched that one, then please go back and watch that. And I will link that to this video as well. But we, in general, human beings as mammals are meant to breastfeed and also sleep in close proximity to each other. And part of that is for survival. Mammals do this as a way to protect their young from predators. As humans, we don't really have to worry about those predators, but this biological norm and need is still very much ingrained in us. And as I mentioned, babies all over the world both bed share and breastfeed, because many cultures understand that there's no such thing as just a baby. There's always a baby and their mother, or a baby and their caregiver. And it's much easier for moms or caregivers to manage things like frequent feeds and the different needs of a baby when they are close by. It's also a really wonderful way to help with any separation anxiety that kind of develops over time as baby's brain develops. And it's also really important to be close to babies at night, because if you did have to respond in some kind of emergency, then you would be able to do so effectively and quickly. And so really, it's just our Western industrialized sort of culture that favors separation, this concept of independence and individuality, and really promoting this independence from an early age. So I want you to take that and think about our sleep training culture that we have in this Western industrialized society, and how they really promote, demand, encourage, and basically tell you that you're doing things wrong if you don't, to be quite honest. Crib sleeping, and often in a separate room. And so if that's working for you, great, keep doing it. But for the most part, the mamas that I work with, that doesn't work. And those mamas are then getting even less sleep, because they're then having to get out of their own beds, walk to a different room, and support their babies at night, meaning that they are actually waking up more fully. So some of the other sleep locations that you maybe have considered or are thinking about or are currently doing. So there's, of course, the crib sleeping. There is sleeping in a bassinet. There is sleeping in the same bed as you. There is also sleeping in co-sleepers, which are often like sidecar sleepers. So that what that means is it's usually like some kind of a little crib kind of thing that's pushed right up against the bed. And then the beds can either be on the floor, so a floor bed. And then the other thing that I want to mention is that there's a lot of misunderstanding between co-sleeping and bed sharing. And this is one of the difficulties, even in research, because there's actually no sort of generalized definition that all research uses. And so sometimes co sleeping means that they're sharing the same bed. Sometimes co sleeping means that they are sharing the same room. Okay. And so we really need to be conscious of that because there's lots of research out there. And if you're not actually looking at the same thing, it's hard to generalize that research, right? And so I really love Professor James McKenna's sort of view on things. And what he talks about the term co sleeping, um, really defining it as mom or primary caregiver and baby sleeping in sensory proximity to one another, which could mean somewhere next to you or in the same room. So, like the bassinet in your room, or the crib in your room, or the sidecar bed next to your bed, or a pack and play in your room, or some other device that you might have where your baby is sleeping. Um, or right in the same bed as you. So the co-sleeping could be in a separate sleep surface, but in the same room, or in the same bed as you. Bed sharing, on the other hand, means that your baby is sleeping in the same bed as you. And so it's really helpful to have that in your mind, that bed sharing can be definitely safe, like I mentioned, and why I mentioned it. And you really want to make sure that you are setting up your bed for safe sleep, as we discussed in part 2, because the reality is that more than likely you will find yourself in a situation at 2 or 3 o'clock in the morning where you're totally exhausted and you just can't. You fall asleep, you're feeding your baby in bed, and you fall asleep. And even if you never have any intention of ever bed sharing, I highly, highly recommend that you set your bed up for safe bed sharing, following those rules that we talked about in part 2. So, making sure that you're not under the influence of any drugs or alcohol. There's no big comforters or pillows or things that baby near their face. There's no cords or anything. There's no gaps that they could fall off the bed with. So you're going to have to set yourself up and think about all of those things. And I highly recommend you do, even if you never take your baby into your bed, because there will be that one night when you're just so tired and you're going to take your baby to feed them in bed because that's just where it's more comfortable, and you're going to probably fall asleep. Or you're going to be so anxious about falling asleep that you're just, going to stress yourself out even more. So why don't you just set up your bed for safe bed sharing, even if you never ever use it? It's always better to be safe than sorry. Okay. And so it's really important also to really be aware that, yes, as much as you would like to sleep in your own room and have your baby in their separate room, maybe your baby makes lots of noise at night, which is not normal, by the way, even though we sort of think it is, but that might mean that there's something underlying going on with their breathing. I will do a separate video on that another time. But so, yes, I understand that sometimes you're woken up by your baby's rustling or noises, or you're thinking maybe that if you're breastfeeding, then your baby smells the milk. I have lots of people that think that, and of course that's partially true. Um, and so you're thinking that they might sleep better in a separate room. Maybe you've worked with a sleep trainer and they have recommended moving your baby into a separate room. But I really want you to know that each country has a different sort of guideline on this, but in general, the guideline is to room share. So whether that is your baby sleeping in the same bed as you, or sleeping in a bassinet or a crib or a pack and play or a sidecar or whatever in the same room as you, at least for the first 6 months of life. A lot of countries actually recommend for the first year of life. Okay. And so this is where you really need to make an informed choice for your own family and what you think is best for your family. I do highly recommend that you at least bed share, or that you at least, room share for the first 6 months. And then you can kind of use your own judgment and your own comfort level to decide whether it is then time to try a separate room or keep baby in your room. And that's going to be different for every family. And there's no right or wrong for that. I want you to really understand that, yes, of course, there's guidelines in place. those guidelines, for the most part, yes, they have your safety in mind, but for the most part, they're there to reduce liability. Let's just be honest here, okay? And that's really what our society is all about these days, is reducing liability and, all of that. Um, of course, they care about your health too and your baby's health, and we want everybody to be safe. But this is where the informed choice comes into play. Okay. Um, so, this is also just thinking about safe sleep. A lot of times you'll hear nothing in baby's crib until 2 years. So, no blankets, no stuffed toys, no crib bumpers, no nothing, just a baby on their crib mattress. And unfortunately, that is the cold and lonely reality of many babies these days. I don't know about you, but I would really hate sleeping on just a bare mattress with no blanket, no pillow, nothing to keep me all snuggly and warm. And I get it. Babies have sometimes you're swaddling your baby or you're using a sleep sack or something like that. And of course, young babies, we don't want them to be at risk for any strangulation or any suffocation or anything like that. But again, you're going to start thinking and using your common sense, looking at your baby, looking at the risk factors, really trying to set up a safe sleep surface for your baby and your family. And that might look a little bit different than somebody else's family and somebody else's baby, because there's going to be different situations and different factors in place and different risk factors and different development. And we really need to remember that we are all unique. Our babies are all unique. And so having like a cookie cutter rules and regulations and guidelines that you feel like, oh my God, if I don't follow these, then I'm going to kill my baby, or what, the sleep training police is going to come after you or whatnot, or even the American Academy of Pediatrics or the Canadian Pediatric Society. Nobody's coming after you. This is where you need to make an informed decision. You need to look at not necessarily look at the research, but you need to at least find some trusted sources where you can get your information. Definitely look at the guidelines and be aware of the guidelines. Definitely look at what risk factors you might have and try to mitigate those risk factors. And look at your baby and what's going on in that specific time frame. And then you're going to make your decision to make the safest sleep sort of surface or sleep location or sleep situation for your baby and your family. So I would love to know where your baby sleeps. Do they sleep in a crib in their own room all night long? Do they start off the night in that situation and then move to your bed halfway through? Do they sleep in a bassinet? Do they sleep in a sidecar next to your bed? Do they sleep in the crib in the same room? I would love to know what sleep sort of situation you have in your family right now, because I bet you lots of us are bringing our babies into bed at some point or another. So let me know your questions. That's it for me today, and I will talk to you guys all